Imagine walking out of your doctor's office feeling relieved because your blood pressure was called acceptable. Then, just a few months later, you suffer a stroke that nobody saw coming. How is that possible? The truth is, thousands of people are told their blood pressure is fine without ever understanding what those numbers actually mean. One number may look perfectly normal, while the other quietly damages your heart, brain, kidneys, and arteries every single day. Today, I'm going to show you the blood pressure pattern that many people completely overlook and why understanding it could change the way you protect your health forever. This isn't about creating fear. It's about giving you the knowledge to recognize warning signs before they become life-changing medical emergencies. A few years ago, I met a retired school principal named Margaret. She was 69 years old, never smoked, walked every morning, and took every medication exactly as her doctor prescribed. At each appointment, she heard the same reassuring words. Everything looks stable. She believed she was doing everything right. Then one afternoon, everything changed. Margaret suddenly struggled to speak. Her husband thought she was joking at first, but within minutes, she couldn't lift her right arm. She was having a stroke. After weeks of rehabilitation, she asked one heartbreaking question. How could this happen if my blood pressure was under control? The answer wasn't simple. Her blood pressure had been measured, but it hadn't truly been understood. And that's a mistake far more common than most people realize. Many patients focus only on hearing that their numbers are okay, without learning what those numbers are actually telling them about their health. After decades of helping adults understand cardiovascular health, I've noticed one recurring problem. People memorize a blood pressure reading, but very few understand the story hidden inside it. Blood pressure isn't just two numbers on a screen. It's an ongoing conversation between your heart, your arteries, and every organ that depends on healthy blood flow. Think of your circulatory system like a city's water supply. When pumps work too hard, pipes slowly wear out. If pressure stays too high day after day, tiny leaks eventually become major problems. Your blood vessels behave in a very similar way. The danger isn't one high reading. It's years of repeated pressure silently damaging artery walls. The important thing to remember is that one elevated reading should never make you panic. Stress, poor sleep, pain, or even drinking coffee shortly before checking your blood pressure can temporarily raise your numbers. That's why doctors pay much more attention to long-term trends than to a single measurement taken on one particular day. The first pattern many people overlook is morning blood pressure. Most people only check their blood pressure during clinic visits, but blood pressure naturally rises after waking. For some individuals, this morning surge becomes unusually large, placing extra strain on blood vessels at the very start of every day. Imagine starting your car every morning by pressing the accelerator all the way down before the engine has warmed up. Over time, that extra stress creates wear and tear. The same idea applies to your cardiovascular system. Checking your blood pressure at the same time each morning, before breakfast and after resting quietly, can reveal important patterns. The second pattern happens while you're asleep. Healthy blood pressure normally drops during sleep, a process doctors often call nighttime dipping. This gives your heart and blood vessels a chance to recover after working all day. But not everyone experiences this healthy nighttime decline. For some people, blood pressure remains elevated throughout the entire night. That means the heart and arteries never truly get a chance to rest. It's like asking someone to work double shifts every single day without a break. In these situations, a doctor may recommend 24-hour blood pressure monitoring instead of relying only on office readings. The third misunderstanding involves salt. Many people believe sodium is the only dietary factor affecting blood pressure. In reality, your overall eating pattern matters much more. Highly processed foods often contain excessive sodium while lacking many nutrients that help support healthy blood vessel function. Someone may stop adding salt to their meals, but still consume large amounts of packaged foods, frozen dinners, and processed snacks. Replacing more of those foods with fruits, vegetables, beans, whole grains, and other minimally processed options can be a practical step towards supporting healthier blood pressure over time. The fourth factor is stress. Your body doesn't always know the difference between a real emergency and constant everyday worry. When stress hormones stay elevated for weeks or months, blood vessels can remain more constricted than they should be, keeping blood pressure higher even after the stressful event has passed. One man told me his blood pressure readings improved noticeably after creating a simple evening routine. His life wasn't suddenly perfect, but his body finally received a consistent daily signal that it was safe to relax. Sometimes, small changes in daily habits make a surprisingly meaningful difference. The fifth overlooked factor is movement. Many people think exercise is only about losing weight, but your arteries see it differently. Regular physical activity helps blood vessels stay flexible and improves how efficiently your cardiovascular system responds to everyday demands, reducing unnecessary strain over time. You don't need marathon training to experience these benefits. Even consistent brisk walking can become one of the most valuable habits for protecting long-term heart health. Small amounts of regular movement often produce greater benefits than occasional bursts of intense exercise that are difficult to maintain. I'd like to ask you something. When you measure your blood pressure, do you usually check it only when you're feeling unwell, or do you have a regular routine? Share your answer in the comments. Your experience could encourage someone else to begin monitoring their own health more consistently. At your next medical appointment, consider asking a few important questions. Are your home readings similar to your office readings? Should you check your blood pressure at different times during the day? Based on your age and medical history, what target range is most appropriate for you? You can also ask whether medications, sleep quality, or other health conditions might be influencing your blood pressure. Writing these questions down before your appointment can make the conversation much more productive and help you leave with a clearer understanding of your cardiovascular health. Here's the encouraging news. Your blood vessels are remarkably responsive to healthy habits. Better sleep, regular movement, balanced nutrition, and taking medications exactly as prescribed all work together over time. Small improvements repeated consistently often matter much more than dramatic changes that only last for a few days. After recovering from her stroke, Margaret made one promise to herself. She stopped chasing perfect numbers and started focusing on consistent habits instead. She walked with her neighbors, prepared more meals at home, tracked her blood pressure carefully, and most importantly, she finally understood what those readings actually meant. Today, Margaret says she feels more confident, not because she's fearless, but because she's informed. Your blood pressure isn't trying to scare you. It's trying to tell you a story. The sooner you learn to read that story, the more opportunities you'll have to protect your health before serious problems develop. Let's quickly review what we've learned today. One normal reading doesn't always reveal the full picture. Blood pressure patterns matter more than isolated numbers. Morning and nighttime readings provide valuable information. Daily habits shape long-term cardiovascular health, and understanding your numbers helps you make better decisions with your healthcare team. If today's video helped you see blood pressure in a completely different way, let me know in the comments. Share this video with someone who checks their blood pressure but isn't sure what the numbers really mean. And if you enjoy practical, science-based health information explained in simple language, subscribe so you don't miss our next video. Remember, this content is educational only and never replaces personalized medical advice from your healthcare provider.